Hello, Bachelor in Pharmacy students. Yes, today we will discuss about 10 marks, very important questions that is selected from your question paper. See, this is the Rajiv Gandhi University question paper. If you are belongs to any other university, okay, any other university which comes under Pharmacy Council of India, then you don't worry. This video is for you also. 4th semester important question. In this video, we will discuss about 10 marks, very important questions and answers. Okay, and explanation also. So maybe this video will be vast, but if you observe this video, if you listen this video, definitely my dear brothers and sisters, you will be genius in the 10 marks of the pharmacology, because that type of questions are there, some tricks are there, I am going to discuss in this video. So give me your time for me. Maybe I will take 30 or 40 minutes, but that 30 or 40 minutes play a vital role here. Just without wasting the time, we will start our question. See, the first question here is explain about different routes of drug administration. See, this question asked many times in our examination 2019. See, explain different routes of drug administration. Same. Then types of receptor. No, I will show you. Yes, explain about different routes of drug administration. This is also they ask one time. Yes, sir. 2 to 3 times they ask in the examination, but sometimes what they will do, they will ask the same question in the 5 marks. Now let's discuss that answer for the particular question. Yes, sir. First what you have to write means, first you write routes of drug administration. Means what is this? See, it is the path by which the drug is introduced into a body for the treatment of the disease through the various routes. Means this drug administration, this is the route. Actually, it is a route. Okay, why we are perceiving this route means to administer the drug inside the body. If a patient is suffering from any disease, means he want to cure that disease, or he want to treat that disease, prevent that disease. What we are doing? We are referring these various types of routes. Now, which the routes are there? Some routes are there. See, like enteral route, parenteral route, topical route, transdermal route, then inhalation route. Then these are the 5 important routes. Let's discuss about the enteral route. See, it is the safest, most economical and convenient route of drug administration, that is enteral route. Then tablets, capsules, powders, then emulsions, mixtures, suspensions, these all are comes under this enteral route. Okay, then enteral route means just from the mouth we are taking. Okay, let's discuss that, you don't worry. For faster response, drug should be taken empty stomach, but to prevent the gastric irritation, drug should be taken after or with meal. See, actually one mechanism is there. Okay, you know that the drug is taken before food only. Maximum drugs are there, you have to take before food. Why you have to take before food means the drug action will be faster. Why means, see, with an example I will show you. Now see, this is your stomach. Now this is the stomach. Sorry for the diagram, but understand. Now this is the stomach. If a food is present in the stomach, means what happens? Now if the food is present in the stomach, after food I am telling, if the food is present in the stomach, if you take the drug after meal, then what happens? These drug will interact with these food molecules. Food molecules and drug interaction takes place. Maybe there is a chance of a reduction of the drug action. Okay, for that reason, mainly the drugs not shows their effect action. Why? Because of this complexation, formation of complex with the food. Okay, so better to take the drug without food, means without food you have to take the drug. After getting half an hour or 2 hours, then you can had a meal. But one problem, to solve that problem, we have to take the drug with the meal or with after the meal. Why? Because means to prevent the gastric irritation. What happens if you take this drug means this drug will liberate the HCl. Okay, that HCl is liberated by the drug also and by also this stomach wall also. There is a chance of gastric irritation. Now different methods in this enteral route we will classify as like oral route. Okay, first we study what is this oral route. Here the drug is administered orally, by mouth we are administering the drug. Here the patient is able to self administer, means he can easily take the drug and the chances of systemic infection are very reduced here. Okay, there is no chance. No chance means 50% reduced. There is a infection, systemic infection. Mechanism is complicated. See, absorption through stomach, mainly in duodenum, having greater absorptive surface that provide entry to the systemic circulation. What happens if we administer the drug through the orally means what happens, you know that first the drug, what happens, it undergoes absorption. The absorption plays very important role here. First it will go to the stomach, after the stomach small intestine. In that small intestine they have mentioned here duodenum region having the more absorption surface area. Okay, that absorbed drug enter into the liver where the first pass metabolism occurs and their action shows. First pass metabolism, second pass metabolism. If the drug fails for the first pass metabolism means then that drug proceed to the second pass metabolism. Clear? This pass metabolism, mainly why this pass metabolism, first pass and second pass metabolism are present means just to expel the drug from the body. Means if the drug accumulation starts in the body means the body, what happens, it shows the toxical effect. Why? Because of the toxic substance. Drug, it is a toxic. If the accumulation of the toxic substance in our body means it will show some of the toxic effects and maybe chance of liver damage. So to prevent these all, our body manages this first pass metabolism and second pass metabolism. Okay, then some of the merits are there for this oral drugs, like safe, convenient and painless. Any external assistance not required. We are not requiring any external assistance here, like tablets, capsules, powders, these all are the oral type. Okay, then demerits, sometimes complete drug is not absorbed. Yes, how the complete drug is not absorbed means by that only after food. Some drugs they are not absorbed, but to prevent the gastric irritability or the gastric irritation, we will take the drug with food or after food. Drug absorption is reduced due to the complex formation. Yes, next one is the sublingual or the buccal route. Sublingual or buccal route, just sublingual or buccal route means here down the tongue we are administering the drug. Drugs is kept beneath the tongue to disintegrate and get absorbed in the mouth. Just down to the tongue or beneath the tongue, like nitroglycerin. Nitroglycerin mainly is used to treat the cardiac patients. Then pyroxicam, mainly these tablets are used to treat the pain, heavy pain, or this is a NSAID, non-steroidal anti-inflammatory drug. Clear? Then the drug enters the systemic circulation through diffusion into the capillary network. See, in our mouth, just to imagine in the mouth, this is the, for example, now see this is the tongue. Now this is the tongue. Down the tongue we are placing that medicine. Now what happens, beside this, just to uphold that tongue and see inside the mirror, you will find some of the capillaries there. Brownish color or the violet color capillaries. That capillaries helps to transfer the drug from up to the liver. Okay, very important that one. That capillaries. Clear? That is the main mechanism you have to understand here. Buccal route. Merits here rapid absorption of the drugs due to the high vascularized site. Therefore, fast onset of action. Stomach enzymes and acids are not involved. No, because the drug is not going to the stomach. So there is no gastric irritability. The drug, what happens, it will just penetrate into the skin of the tongue and enters into that vessels and it shows through the to the action. No first pass metabolism. Yes, there is no first pass metabolism. Demerits. No first pass, but the drug gets expelled. Why? Because means in our body one metabolism system is there that will degrade the drug. Clear? Then demerits. It is sometimes inconvenient to keep a drug in mouth. Sometimes it is inconvenient. So we are not referring this drug. Then rectal route. It is also one enteral route of the drug administration. Suppositories are the drug that are administered through rectal route. Okay, anal route what we are calling. No, drug abundance occurs directly through thin, highly vascularized wall of the rectum. Merits here useful when patient is suffering from nausea and vomiting. Gastric irritation drugs can be administered by this route. These are the merits. One more merits is in the children. Those children we are cannot administer through their mouth, then we can give through this rectal type of the route. Demerits here, rectal inflammation will be there and irregular absorption will be there. If there is irregular absorption means the action of the drug is reduced. Okay, that's one problem is there. Next one is our second classification, important classification, that is parenteral route. See, all the route of drug administration other than the enteral route, they comes under the parenteral route. Just parenteral route means you understand one thing. Parenteral is nothing but these IV routes. Okay, just what we are injecting through the intravenous, these all are the parenteral routes. See, some are subcutaneous, some are intramuscular, some are intravenous. Now what are those subcutaneous, intramuscular and intravenous? First discuss one by one. Subcutaneous injection is administered into fatty layer of the skin directly below the dermis and the epidermis. Subcutaneous, what we are doing means just we are inserting below the dermis, just this much. See, now this directly 90 degrees, that is different, but here subcutaneous means just we are bending our needle to insert this type of the subcutaneous injections. And there are very effective in administration of the vaccines such as mumps, rubella and measles vaccine, corona vaccine. In that corona vaccine, subcutaneous we are giving for some patient. Maximum in COVID days, the COVID injection 1 ml it is vaccine. So most probably in the hospital they are given the intramuscular, okay, to your arm. Then insulins are also used by this route. Merits, it is a self-administration, means a self-administering. We can easily administer that drug without any complications. It is easily administered. Then complete absorption of the drug take place. Demerits, it is a painful irritation. Drugs cause tissue damage. Maximum 2 ml of the dose may be injected. Without more than 2 ml we cannot inject here. Then intramuscular, it is also known as IM route. The drug is delivered in the form of aqueous solution or depot preparations. Okay, this technique used to deliver a medication deep into the muscles. This allows the medication to absorb into the bloodstream quickly. Examples like penicillin, benzathine penicillin, vaccines, then hormonal agents like testosterone, we are giving by this type of the route, that is intramuscular route. Okay, then some of the merits of this intramuscular route are, you don't worry about the notes, you will get the notes in the description. Uniform absorption, onset of action is fast, no gastrointestinal tract related factors. Demerits, only 10 ml drug can be administered by this type and it is expensive also. The last one is our intravenous. See, most probably this is the required and commercial also and mostly used method, that is intravenous. Administration of the drug into the veins through the injections, the first pass metabolism by the liver can be avoided here. Okay, that is for an example pantoprazole IV, pan IV. If the patient is suffering from hyperacidity, gastric or stomach pain, then we are giving this pan IV. Merits is it is 100% bioavailability. What is bioavailability? We have made one video in the medicinal chemistry. Go and observe that, you can get the knowledge. Then large quantities, it is in emergency situations we have to give this intravenous route only. Okay, why? Because means the blood, it is in circulatory way, circulation. Okay, in the circulation what happens, if you directly give the into the intravenous into the blood veins means the blood circulation is very fast, so it shows the action very fast. It goes to the brain and suppresses the required neurosensors. Then demerits, painful, causing irritation, technically untrained persons required, which is sometimes these are costly also, and technically prepared, well maintained, okay, workers are or staff is required for this. Then topical route, our third classification, the drug is applied on the surface of the skin or the mucous membrane by means of the special formulation. Topical route means just we are using creams, ointment, gel, lotion, spray, powders. This all comes under the topical route. The drug is absorbed through the pores present in the skin. In the skin, see here these are the pores. Some pores are present here, see. You are observing some pore, dot. That pores, these will absorb the drug content and come across the various diseases. If you are suffering from any skin infection, means the doctor will give you some of the ointments, some of the creams, lotions. While you apply on that infected or fungicidal area, means what happens, the activity of the drug shows. How it shows? By the mechanism, it insert or it penetrates into the pores of the skin and shows their action. Inhalation route, inhalatory or the inhalational route. Here what happens, some of the inhalatory drugs, like it delivers the drug through the respiratory tract, mucous membrane and pulmonary epithelium. For an example, in today's generation, many asthma patients are there. More than 1 million asthma patients in India, we have observed more than 1 million, they are taking this inhalatory drugs or inhalation techniques, like it gives fast effect, that intravenous route. Greater than the intravenous, it gives a fast action, like salbutamol ho, corticosteroids, fluticasone. You know that Otrivin drops Otrivin, see, it is a nasal spray. We are giving into the Nazivion, Otrivin. In the same way, some of the drugs are there that given by the inhalation. Okay, that is also one type. Which one? That Otrivin also, it comes under this inhalation. Then merits rapid absorption, very less side effects. That is a first pass metabolism is absent here. Demerits specialized equipment required. Yes, some of the drops are required here. Then due to the use of inhaler, dose regulation is difficult. We have to maintain the dose regulation, but also that problem also reduced now because the dose count has already been fixed into the some of the machines nowadays. But the one problem is the machines are costly here, 350 rupees, 400 rupees a particular machine. So that's one problem. Next is the next question over, write the principle and the mechanism of the drug action. See, this question also asked once in our examination, principle and mechanism. I will show you. Yes, in the year 2019, see, write the principle and mechanism of the drug action. And also in 5 marks, this question repeated many times, principle and mechanism. Okay, so if we practice in 10 marks means we are having the dual advantage. 10 marks, if they ask means we can write. If they ask in 5 marks, we can write that also. Okay, and some questions are there, I have already completed in the medicinal chemistry, like epileptics, sedatives, benzodiazepines. Some questions they are asked in pharmacology also. That questions I won't explain here, but I will add the notes in the description. If you want the lecture for that, inshallah, that too I will add in the description. You are not explained by your college, but by the way you are not understand the topic means you can watch this video. Maybe this video will be helpful for you. Yes, now the principle is no new functions can be imparted by any drug to a cell, an organism or a system. Okay, the decreased activity of the cell can only be altered. See here, one point to understand here, the drug what we are giving, no, that drug will not change any function of the cell. Just what it will do, or it not alter the cell here, just it will increase the stability, or it will increase the enzymatic character of the particular cell. Okay, for an example, see, now I am going to from here for 10 kilometers walk. Then from normal walk I will take 15 minutes. From 10, for an example, for a normal walk I will take 15 minutes. If any suppositories will be given for me, or any supplements like protein shake, or any type of the drinks like without alcohol drinks are available, no, codeine drinks, that codeine drinks, it will boost my mind and it helps to run me faster. Okay, or glucose, it helps to run me faster. Why? Means we are giving external supplements to increase their action. So in the same way here, drug what it will do, it will just increase the action of the enzyme, that much. Okay, the decreased activity of the cell can only be altered here. Okay, understand the concept. Any of the ways mentioned below, drugs can produce their effect like a stimulation, depression, irritation, replacement and cytotoxic action. These all are the principle. Among these principle we are conducting our drug actions. First one, stimulation. You know that stimulation is nothing but penetrating stimulation. It is increased activity of the specialized cells. A cell that has been stimulated excessively shows alternation in its protoplasm, which may also eventually depress the cell activity. Very simple here. Some drugs what they will do, they will stimulate the protoplasm. Okay, sometimes certain portions of the particular system may specially be stimulated by a drug, whereas others may be depressed. Some drugs what they will do, some drugs will be stimulated and some drug will be depressed. Okay, both formulations should be acquired here by the drug. Why? Because means, see, for an example, if you take one drug means at particular stage that drug should be shows their negative action also. Means negative action means it should be depleted, or it should be reducted, or it should be decrease their action. If the drug won't reduce their action means it shows without stopping the regular actions, means what happens, that leads to many toxic effects inside the body. So After stimulation, the drug should be destimulated at a particular time. For an example, morphine is to stimulate the vagus nerve and the accumulatory nuclei. At the same, it depresses cup center. See, morphine, sometimes what it will do, it will stimulate the vagus and the accumulatory nuclei. Morphine, it is a painkiller. Okay, it is a narcotic painkiller. It will suppress the pain, it will decrease the pain. On the other hand, what it will do, not suppress, stimulate, it will stimulate the vagus nerve, but on the other hand, it will depress the cup center. In the brain, one cup center is present. Okay, in your midbrain, cup center is present. This morphine, it will decrease that cup center. Okay, by that if you are coughing, means that cup center depressed and you stops from coughing. Like codeine phosphate we are giving. We are means in the medical shops, codeine phosphate is present. If that we drink 2 caps, means 10 ml morning and 10 ml evening, means that will stops your cough immediately, but it is NRX drug, narcotic drug. It is better, you should not take that drug. It is very habitat. Yes, next one is depression. It is a decreased activity of the specialized cell. Like example, means depression means just the activity of the cell get decreased, no activity. Like quinidine is a drug known to have depressing effect on the myocardium. Okay, quinidine, it is a drug, it will depress the action of the by the action of the myocardium. It is the heart cell. Irritation, the adverse effect produced by a drug on the growth, nutrition and morphology of living tissues are described under the term irritation. Hence the irritation is not particularly in the cell, it can be anywhere. Not particularly in the cell, it can be anywhere. Like it can inside the cell or outside the cell, intracellular, extracellular. By giving some of the medication, we can prevent this irritation. Irritation also occurs by some of the drugs, by inhaling the drugs, by taking the drugs. Yes, the next one is a replacement. See, what we all studied know, this replacement, irritation or the depression, suppression, these all are the principles of the drug. Means these all are the characteristics or activity of the drug. Okay, now for an example, see, you will now understand this, what is the actually the principle is. See, when the production of the endogenous substances decreases, drugs may be used as a replacement. For an example, if any enzymatic character inside the body decreases, means then what we are doing means, or any enzyme or any hormone, if the characters or if the production or if the function of that particular hormone or enzyme decrease, means then we are replacing. Okay, we are not replacing directly the organ, means just we are promoting or just we are pushing the hormone or we are pushing that organ to release the hormone. Okay, by on the basis of the receptor, on the mainly our body is dependent on the receptors, they will receive the drug and they will show the action. For an example, insulin in diabetes mellitus, hydrocortisone in the treatment of Addison's disease. Now, if the patient is suffering from the diabetes mellitus, means his sugar level is more than 145, means 180 mmHg, 190, 220, 230, 240. Why? Means because of the insulin production is less. There in the diabetes patient, due to the less production of the insulin, the glucose production increases. That deposition of the glucose leads to the diabetes mellitus. So, we are giving here, we are replacing that insulin by some of the vials, insulin vials, human mixtard, human actrapid. What vials are recombinant DNA. Vials prepared by this some of the scientists. So what we are giving, we are providing that type of the insulin, external insulin to the patient. Okay, that external insulin actually it act as a insulin. Okay, just we are providing the replaced insulin. Then cytotoxic action, the cytotoxic drug that contain chemicals which are toxic to cell. Okay, then preventing their replication or growth. Some drugs are there, see what they will do, they will show the cytotoxic action. Basically they are used to treat the cancer. Now see, for the cancer, you know that in cancer what happens, the cell shows the multiplication, the division. Okay, to break down, to stop that multiplication of the cell, diseased cell or the dead cell, we are giving this cytotoxic action, we are giving this cytotoxic drug, that they will inhibit the that replication or the multiplication of the cell. Okay, basically these are used in the treatment of the cancer. Which one? That is cytotoxic action principle. Yes, this is the principle. Now let's discuss about the mechanism. What our mechanism says, mechanism of the drug action is very simple. The action of most drug is brought about by their influence on the control system of the body. Okay, mainly action is done on the receptors. The receptors will take that and they will, with the help of the neural signals, they reaches to the brain. Okay, they will show the action. A drug may act on the cell membrane, or drug may undergo metabolic process to complete the mechanism of the drug. Yes, you know that the drug may be act on the cell membrane, like some of the ointments, creams, lotions, and also some drugs they will act on the first phase metabolism and second phase metabolism. How? By IV route, second phase metabolism, or by administering the drug through the oral route, rectal route. These all. Transport process, classification of this mechanism. Then first one is a transport process, enzyme, ion channels, receptors. Very important one. If we understand these four concepts, means no doubt you become a pharmacist, hop pharmacist here. Okay. Transport system. The sodium pump, potassium pump, calcium pump, these are the three main pumps. These pumps are present in the gastric parenchymal cell, which are targeted by the omeprazole, the inhibitor of the proton pump. See what happens in our stomach. How the patient is known as a hyperacidic patient means, if the production of the H plus increases, means what happens, that H plus combines with the chlorine and forms the HCl gas. H plus, if increase in the H plus, means that leads to hyperacidity. Now this omeprazole, what it will do, it will suppress that one, or it will inhibit the production of the proton. So these are inhibitor of the proton pump. Which one is that? That is omeprazole. Okay, and that this inhibition is mainly controlled by these pumps: sodium pump, calcium pump, and potassium pump. Maintenance of the osmotic balance and the volume of the cell, along with the maintenance of the membrane potential, are significant functions performed by the sodium pump. All these maintenance, like osmotic balance, water balance, these all are maintained by the sodium pump inside the body. Okay, for that reason the sodium pump is very important here. Why it is blur, man? Yes, in many cells it forms the most important mechanism that transport sodium outside the cell. You know that sodium will transport outside the cell and potassium inside the cell. In nephron, myocardium. Okay, these are the example. In nephron or myocardium, these pumps are very important. They helps to maintain the osmotic balance. Okay, and also they help for the transportation in nephron and myocardium, etc. Then symporters and antiporters, means exchangers, are the main transporters involved in the drug action. Which are that? Symporters and the antiporters. These are the exchangers. They help for the transportation. If any blockage is there, means these symporters and antiporters, they will help for the transport that particular drug. Next one is enzymes. Enzymes, you know that enzyme action is catalyzation. They will break down the product. They will break down the drug. The complex drug, if we break down that complex drug, means the drug changes into the simple. Now you tell me one thing, the drug which is breakdown is better, or the drug which is wholly, means the complex drug, is better? Yes, your answer is, sir, the drug which is in complex or the joined drug, that is better than this simple drug. Why? Because means the action while catabolism of the drug, the action of the drug decreases. Why means? Why? Yes, absolutely. Why means if you break down the product, means the action of the drug decreases, the concentration of the drug decreases. For an example, you take 10 ml of the phenol or cresol. This is a disinfectant. You mix that phenol into the 20 ml of the water. Now you are diluting. No, here dilution means just what you are doing, you are breaking down the products. You are breaking the shine here. hydrogen bonds, covalent bonds you are breaking here. That breaking will reduce the drug action. Simple. This is the function of the enzyme. But in my human body, in yours human body, not only human body, in all animals, in humans, those you are living, the enzyme action is very important here. Without enzyme, no digestion. Without enzyme, no absorption of the drug. Enzymes, receptors, transportation, ion channels, these are the major points we should remember inside our body. Now let's see what actually that enzyme says. You know that enzymes catalyze almost all the biological reactions. Thus enzymes are important to form targets for the action of the drug. A drug has the capacity to alter the reactions which are mediated by enzymes, either by increasing or decreasing the rate at which the reaction is taking place. What is the meaning of this sentence is the drug having the capacity, okay, they are having that maintenance rule that they can either alter, means they can increase or decrease the rate of the enzyme. Okay, the drug having the such capacity. Thus the action of the drug can be enzymatic or stimulation or inhibition. Next, ion channels. It is our third mechanism. How ion channels? See, drugs can also act on ion channels. You know that sodium pump, potassium pump. Mainly these pumps, what you are observing now, that pump should be comes under this channel only. Okay, that is ion channel. Ion channels may be ligand gated, indirect or direct. The ligand gated channels open up when the drug combines with the receptor. I will explain you this term. See, for an example, now this is the cell wall. This cell wall contains some of the receptors. Some receptors are inside the cell, some receptors are outside the cell. Now the drug interacts with this. The drug, if it interacts with the receptors, then what happens? There is a opening of the channel takes place. The same they have said here with the receptor. Such indirect the ligand gated ion channels open. When it opens, when the drug combines with the receptor. When this drug combines with the receptor, no, there are channels are present. Okay, the channels, ligand gated channels or ionic channels get opens. By this opening of the channels, what happens? These drugs, what they will do? They will enter where? Into the cell membrane and shows their action. Very simple. One important concept I want to tell you. This is the cell wall. What is this? This is the cell wall. Now this is the drug. Okay. Now see, the receptor work is to receive the drug. Directly what happens? Your drug won't shows the action on the receptors. No, it won't show. See, now directly drug go and binds with the receptor. Now suddenly it won't shows the action. That receptor should be proceeded inside the wall. The receptor should be proceeded inside the cell wall. That it should be gives to the other receptors. Like this type of chain is there. Like G protein coupled receptors is there. No, you will study that later. That JAK-STAT mechanism is there. Everything is there. You study later. You understand this one. No receptors having the ability to show the actor act immediately. The drug, they will receive this and they will proceed to the further receptors. Very simple. This concept you understand. Then such indirect interactions commonly involve in the G proteins. Now the blockage of the voltage dependent sodium channels by local anesthetics showing a typical interaction between the drug and the ion channel. Now see, while we are giving the local anesthetics, now why the patient is in coma condition, if we give the local anesthetic, because what it will do means these drug and the receptors, they will form on complex, means they join together and they form on complex. This formation of the complex, what they will do, they will block this sodium channel. They won't allow this to enter the sodium channel. They won't allow to pump the sodium ions inside the body. For that reason, the person is unable to respond, means he is in primary coma. Many types of anesthetics are there. General anesthetics, local anesthetics, many types of anesthetics are there. Depending on the condition, we are giving the anesthetics. Then the opening of the chloride channel is facilitated by the benzodiazepine that bind to the GABA receptor chloride channel complex. As a result, the state of hyperpolarization is seen. See, one more very important thing. GABA's main function, that is a gamma aminobutyric acid. This GABA, it is a neurotransmitter. Mainly, it helps to control the excitation. Controls the excitation. Now what happens if this GABA get binds with the benzodiazepine, there is a formation of one complex. Okay, one complex. These benzodiazepines, what they will do, they will inhibit the GABA. As the GABA inhibited, the repolarization takes place, hyperpolarization takes place, means over excitation. Why? Means because GABAs are absent here. GABA is held by this type of the benzodiazepine drug. So this holding increases the hyperpolarization. Some agents modulating this channel in opposite way to that benzodiazepine, that are known as an inverse agent. Means to increase the effect of GABA or to remove the interaction between the GABA and the benzodiazepines, we are giving some of the inverse agents. Next one is receptors. The cell membrane present within a human cell regulates the entry and exit of the molecule or substance because of its selective permeable nature. See here, this receptor, you know that cell wall, it is a selective permeable, means it won't allow all the particles inside the cell. These are selective permeable. They allows only such things which are important for the human body. Sometimes non-important things also enter into the human body through the porous skin. Okay, then it consists of a thin phospholipid bilayer embedded with the proteins. You know that our layer, that is biphosphate layer, we call, that is made up of this protein and some of the lipid contents. Receptor used to designate these protein molecules. Now which of the protein molecules, like hormones, some of the drugs and neurotransmitters, these are worked on the receptors. Receptors, I have told you, are very very important thing in the human body. Not only very important, we can't tell that this one is important, this one is important. The whole body is very important here. It plays a crucial role. If any one thing is absent in the human body, he or she may be suffering from various kinds of diseases that leads to many major diseases, diagnosis. So see, a single minor absence of these channels or enzymes may leads to the imbalance of the human body. Next, the types of receptors. Ligand gated ion channel, I have told you, that is ionotropic receptors. Indirect receptors, these are GABA receptors which binds to the benzodiazepines. Yes, you know that these are the GABA receptors that binds with the benzodiazepine and leads to the hyperpolarization. Next, some G protein coupled receptors, these are the adrenoreceptors. Adrenoreceptors. Then kinase linked receptors, these are also protein receptors. Insulin receptors, to receive the insulin. Then nuclear receptors, these are the thyroid receptors, means they will act on the thyroid, they will act on the insulin, they will receive the insulin on, means these receptors, they will receive the insulin. Okay, they maintain the insulin production, they maintain the thyroid production. Then G protein coupled receptor, adrenoreceptor, very important, this one G coupled. Inshallah, in next video we will study this G protein coupled receptors. What is this, the theory of this and everything. In this video the 2 questions are enough. In tomorrow's question, remaining 3 questions are there, a 10 marks very important question. Inshallah, in next video we will discuss that. So maybe the video will be very large, means the duration of the video, the time of the video is heavy. You have to maintain that because there is no time. So I had made this video in a longer duration. So it's my request to watch this video, then only you will pass the examination. Okay, you take the notes from the description and read only this. Thank you.